I would say that what makes our emergency care center different than other areas is that we are about the patient. We go to the patient. So from the minute the patient comes into the door, we go out and greet them. We bring them back into a room. A nurse or another member of our team meets the patient in the room. The doctor meets the patient in the room. The patient goes over for an imaging test. The x-ray tech or the imaging personnel comes and gets the patient, brings them there. We're about coming to the patient instead of having the patient wait. We have a lot of innovation here that helps us with our communication and with making the patient's experience quicker and more timely than where I've worked previous. It's a great place to work, but I hope that it's a great place for our patients to come to and keep coming to. My favorite part is coming to work, taking care of the patients, the community, being here, being with all of my coworkers, my team that I work with. We all work well together. We all have each other's back, from our techs to our PFAs that work with us. We all just get the job done. We do it in a timely. We are totally 100% patient focused, which isn't where I've worked previous. That's been all about the patient. It's totally different here. From the time that they walk in the door and when I walk in the door, we're about the patients, and it's a joy to come to work with my team each day. People are surprised that when they walk in the door, oh, you're here? Oh, you're open? Oh, it's so new. We're here, and we want to see them as much as, unfortunately, they have to come and see us. We're happy that they're here, unfortunately, that they have to come in under the situations and circumstances that they are, but we're here, we're growing. We have a lot of services, and we are increasing our services. We see all different types of patients, from urgent care patients, kind of sore throats, all the way up to people coming here because they think they might be having a heart attack. The ECC and us as a team have gone above and beyond expectations. We do that every day. I feel like we do that differently for each patient that comes in the door. We treat them as an individual. Whether they're a baby, we also treat the parents that are caring for that baby, up until grandma who's here with her grandchildren or her daughters. We go above and beyond each step that the patient's here. We try to individualize their care plans and individualize the patient needs, and we want to make each patient's experience one that's individualized and special for them. So we do it quite a bit. I don't have a specific example. I would just say that each day we hope that when the patients leave that we touch them somehow, and somehow they touched us in a way that will leave a little memory with us. For us, it's the communication. We have to communicate from the time the patient comes in the door to the doctors that are caring for these patients, to everybody that works, the volunteers, the people that stock our linens, the techs. We have to communicate whether we're busy, whether we're not busy, what the patient needs. So communication between the doctors here at Maple Grove and the nurses and the PFAs and the HUCs is unlike any other that I've ever worked before. We're a team effort, which it would also be one of our values, the teamwork. We get the job done right away, as soon as we can, to help that patient, and also for our satisfaction. We want the patient to feel comfortable, because if they're comfortable, then we feel like we did our job. So I would say the teamwork, and we're all proud to be here. We all applied, here because we wanted a change and wanted something different, and we all kind of each have our own kind of set of values of our own within ourselves that are able to bring here to Maple Grove, and you're able to share those. So the communication from where you've been before and bringing that to Maple Grove and sharing your experiences where you've worked before, we've been able to bring some of them and change some of them that we didn't like. So it's a good place to work. What I enjoy most about working in the ECC is being with my coworkers. We're like my family away from home. We all help each other, we support each other, we are open with each other, we trust each other, we have each other's back when it's a busy shift. It's my favorite thing about working in the emergency care center at Maple Grove.